All right, well, welcome back. If you want something to jolt you out of bed, well, going to the dentist can be a frightening experience for many of us, let alone children. But those painful days of drilling and injections might just be a thing of the past.
I bet you it's drilling. It's when you hear it next door, it kind of freaks you out, you know. But anyway, today doctors are recognizing the need to adopt new ways to improve their patients' experiences. And clinics are not only undergoing a facelift, but also offering new technologies to enhance performance and, of course, comfort.
Well, in the first of our 8-part series called Say Ah, my colleague Suzanne Zhang takes a tour of today's clinics and explores the technology behind the new world of dentistry.
Dentists are changing the way they do business. Gone are the days when you walk in and feel the jitters as you wait in a room full of posters and dental images on the wall. Like doctors, many dentists are today rethinking their bedside manner to make sure that patients' every visit is a pleasant and relaxing experience from the minute they step in, all in the name of numbing the prospect of pain. We're seeing more and more dentists go high-tech, and that's because cutting-edge innovations in dental instruments mean less discomfort and less time on the dental chair. So what's the latest and what should you take note of? Let's find out. One breakthrough machine that's just been brought into Singapore is the Cone Beam CT Master. It is the only machine of its kind in Asia outside of Korea.
Most radiograph, the traditional ones, is two-dimensional. When you have a two-dimensional picture, what you can't see is the depth, meaning the width. For example, you may see that, oh, this patient have the depth in terms of the bone, but when it comes to a CT, you can see the three-dimensional picture. What is behind what you see as a two-dimensional picture? That is very crucial.
So how does it help you? Does that mean that before it was sort of a trial and error?
Yeah, when we place implant in the past, I have to say that it's a lot of trial and error, and based on experience. And people say experience is the more mistakes you have, exactly. you gain more. But now today is we expect things to be more or less quite accurate, because we can actually now see the three-dimensional picture. For example, in the past, we may have to tell you, oh, when we cut the gums open, then we see what is underneath, and then we place the implant. So sometimes we make mistakes. But today, no, patient actually can see what is in their mouth, and we can actually plan it together with the patient. And later on, I can show it today. Yeah.
That sounds really reassuring to know that there is no room for mistakes now. But this machine, you must have, paid quite a big bill for this. Does that affect us as patients?
Actually, a lot of people have asked these questions, but I can tell you it's not, because with this machine, I can save the patient's appointment time. I can save a lot of clinical chair time, because I do not have to waste a lot of time to guess whether this is okay or not.
Right.
And actually, I cut down a lot of risk that's involved, which means that less risk means we are able to treat more cases. So, in fact, if you ask me, we didn't charge anything higher than that. In fact, we find that with this machine, we actually treating patient more efficiently. Efficiency is very important to a clinical practice. Then we actually can treat more patients.
Another instrument that helps dentists gain greater knowledge of their patient's jaw to accurately plan the procedures is the CAD/CAM machine. It's been around for quite some time, and many clinics have adopted this already.
Basically, you design on a computer. For example, just now we took the CT scan, right? So this will be downloaded into this computer software. And from the software, you actually can sit down with your patient and tell them, oh, look, this is your nerve canal. Is there any defect within your bone? When we place the implant, what kind of length that we want to put in. So everything is predetermined.
So you download it into this computer, and then what next? Do you actually design the crown?
Yeah. We actually can design the crown. We can actually, you see, the fit of the crown is the most crucial. So with the computer, they actually can mark up where is the margin of the crown. And then we can actually, after we design the coping, and we send it to Sweden. And Sweden will design everything, manufactured it, and send it back to us within 5 days. And from then on, our technician or I call them ceramics because it's a piece of art, right? So they can actually customize something specifically for one patient.
So when you're designing, let's say you're designing a crown for me, what are the kind of things that you will look out for, the factors that will determine how my crown will look like?
Right. For example, if it's anterior, first of all, we have to match with the rest of your teeth. Otherwise, you have one crown that stands out among the rest. So the next thing is we have to look at your age, whether we want to make it longer, we want to make it more translucent. Some patient wants it to be brighter, right? Some of them, they want it to be softer. Softer means we have to customize differently.
After all the assessments are done, what you want next is a painless experience on the dental chair. Ask your dentist about the water lace technique. It is what many call the answer to a no pain, no drill, and no injection dental treatment.
I think if we look at dentistry, one of the biggest things we have to address is fear of pain. Dentist pain is always synonymous. So if water lace and water lace really can address the issue of discomfort in many of the procedures, I think it's really a breakthrough. And I think more than that, it really helps when there's very little bleeding after any procedure. It helps us to do more and faster. And at the same time, it really helps in terms of post-procedure healing. Heals better, it's less painful, less swelling. I think that's really a breakthrough. This laser energizes water droplets. So that forms the cutting, or what we call the ablation edge of the laser. So it's really very gentle because it's really just like splashing water on tissue, but at the same time, it's actually removing and cutting. So it's very, very gentle. So that's the technology that's involved.
Beyond minimizing pain, what other benefits does water lace technology bring?
I think, of course, the comfort is one of the major factors, but a little more than that, it's also very precise. And if we're talking about laser pinpoint and we're adjusting the stream of water, the shape of that, you can actually get very precise procedures done. In soft tissue like gum and so on, and you actually minimize bleeding a lot. So, you get less blood, you get better healing. Of course, laser itself has this property we call biostimulation. So laser biostimulation actually helps the cells to grow better, to heal better, and actually less pain even after any procedure.
That's not all in terms of innovation. Today, dental clinics are also offering state-of-the-art facilities that aim to relieve your tension. Apart from the typical reading material, clinics now offer bars where you can sit back and relax, or special entertainment tools that the dentist hopes will keep you distracted for the moment. Or the ultimate stress reliever, some clinics even offer massage chairs to help you loosen up a bit. Another new thing cropping up is playrooms for young children. Some dentists have set them up to give the little ones their bit of fun and their caregivers a bit of relief before they go in and meet the dentist and say, ah.
You know what? Yeah. You know, the thing is, about 6 months ago, I had my wisdom teeth pulled. I have to tell you, it was my first. And it did not hurt. But you know what was the shock and horror effect? Was seeing the blood, I almost collapsed, you know?
Yeah.
So
in this day and age, you don't need to feel the pain. There's no pain. There's usually, they give you an injection,
no
you know,
pain,
it's the after effect
but you see
maybe,
the blood, and it just completely blew me away.
But I love that feeling after the dentist, your mouth is all fresh and
but at what pain? Ooh.
No pain involved. Well, I'm all right with dentists. Okay.
Bone shivering.
It's not so bad. We're going to take off for a short break. Stay with us here at 5:30 Morning. Still on Small Hit.